Hi, Dr. Bert Peterson. Thank you so much for spending some time with me tonight talking about effective communication between doctors and patients. I know that you yourself, you're a cancer surgeon and a breast cancer specialist, and I really appreciate you spending time with me, especially since you're the former medical correspondent for CBS News in New York. So thank you very much. I know it's a late hour.
Well, thank you for having me.
So one of the things that I wanted to ask you was, how can people really work toward effective communication with their doctor? What are some tips that you might have?
Sure. Well, if I look for myself, right, I always start with, am I listening to what's actually coming out of my patient's mouth, what they're actually saying to me, rather than my interpretation of what they're saying to me? So the first tip that I would say to the patient is make sure you're actually listening to what's actually being said. And if you're not able to do that, bring in some other sets of ears, like come with some family members who could also share in that listening experience so that we're all on the same page at the end of the consultation. And as we move our relationship forward, you know, one of the things that I encourage patients to do if they come in by themselves and they're having a difficult time hearing what I have to say, perhaps because I just said to you, you know, I think you may need surgery, or I've just diagnosed a patient with breast cancer. Why don't we stop the consultation? And I encourage patients to do this and reschedule at a time, come in with those family members. Then another thing that I think makes a huge difference in that kind of effective communication with your physician is to be authentic.
Yes.
It's for me to be myself as a physician when I'm taking care of you. It's also important that you just be yourself. So really share yourself. What's important to you? What's going to make the biggest difference for you as we embark on this journey, which oftentimes is a difficult one with my patients because I deal with breast cancer patients. What's really important to you? You know, for the young woman that I may be taking care of, you know, what may be important for her is getting married and having children. Well, we now need to develop a treatment plan that's going to work for her. So tell me what's important to you.
Yes.
And when you're being authentic and I'm being authentic, what's really important about that, why that's so important, is that we create a safe environment in which to just create that healing that's so important. And we can't do that if we're having secrets from each other. So it's important that if you want to try alternative medicines, or there's some herbal remedy that you've heard about, let's talk it through and see if it actually would make the difference or a difference in your healing. And I think that's really, really important as well.
And I think so, you know, about the listening, I think many of us feel like the doctor's always talking. So I hear you saying, like, let's both be listening instead of making up what he might be meaning this. Let's actually listen to what he's saying and then bringing my commitment.
As a surgeon, we tend to talk a lot. So you're absolutely right. It's important to shut up sometimes so that you could listen to what people are saying.
Yeah, and then also talk about our life commitments, like what we're really doing in our life, rather than just dealing with the disease that we're talking about with you, which could be a pitfall for people. And I don't know that many people do feel like a hospital is a safe environment. So when the physician and the patient can create that together, that's wonderful. Now, what makes you you know, tell me a little bit about your credentialing, where you studied to be a surgeon.
Sure. Well, I attended undergraduate school and medical school training at Johns Hopkins University, and then I trained in general surgery at George Washington University Medical Center in Washington, D.C., and I trained in cancer surgery at Memorial Sloan Kettering Cancer Center in New York City, which is where I practice right now.
And what sets you apart from all the other surgeons? You were talking earlier about the special relationship that you feel that you have, and what are some qualities that makes you a little different than other surgeons?
Well, one thing that sets me apart is that I actually did training in how to listen and how to communicate effectively with others. You know, how do I elicit the best in other people when I have a commitment for them to thrive and to actually excel in what's important to them. So I actually did that kind of work and education to be masterful at that.
And it's the world's largest personal and professional training and development company, Landmark Education, and you also do part-time leadership courses with them as well?
Yes, I actually train. I lead. I'm sorry. I lead the leadership training program for Landmark Education, which distinguishes a brand of leadership that really comes from your ability to listen to what makes the difference for people and what they care about and what really, really matters to them.
I can just imagine if we had a world full of doctors who came from that listening perspective and that commitment and communication. And I find it interesting when I talked to you earlier, you said it, how many years did it take you to be a doctor? And then so you had like your medical training and then you had your communication training.
Well, I love to share with people that after high school, it took 17 years of training before I became a cancer surgeon. And yet the education and the training that I received at Landmark Education, I use more throughout the day on a daily basis than those 17 years of education. Because if you look at, as human beings, whether you're a surgeon or you're a publicist like yourself, most of our day is spent interacting with other human beings. So much of the quality of our life is really shaped by the quality of those interactions. And I know for myself, when I started to have these incredible intimate relationships with my patients, what I mean by intimate, I mean that kind of relatedness that could only come from two people really being present to what their commitments are. The entire quality of my day completely changed. It was my ability to perform and my experience of myself as a physician completely changed. And I just want to share one quick thing with you. My residents often say to me, they say, Dr. Peterson, your office hours are so different than when we go to other attendings' office hours. Your patients are happy and they're always hugging and kissing you, and it's so different. And I know, I'm clear, it's a direct correlation to my ability I'm a huggy, kissy kind of guy, and it's a direct correlation to my ability to just be myself, listen, and create that kind of healing environment for my patients, which really was that breakthrough opening that I had from Landmark Education.
Thank you so much. And I agree in my own life with the contribution that Landmark Education taught me as well. So thank you so much. And I know that I am sharing this for PR purposes. And for those media who are interested in booking Dr. Peterson, please contact me. My name is Michelle Tennant. You can reach me at Twitter at Michelle Tennant, MICHELLE, T as in Thomas, ENNANT. Thanks again, Dr. Peterson.
Thank you so much.